Molly, how about at HHS, National Coordinator for Health IT? Your reach is massive as you described there. You want to give us an example of a an effort you have underway there?
Sure. So it was hard to pick one, but I did mention TEFCA earlier. And
Yeah. Yeah.
TEFCA, we like to, talk about it as our network of networks. And I think that's one of our most prominent use cases that we can talk about today. It's made a huge amount of progress over the years. So if you had heard of it in the past, we were talking about the qualified health information networks that were beginning to join. Today, we have up to 11 QHINs who are now working across the country to connect different networks, to connect providers, public health agencies, federal partners. We also now have Indian Health Services and the Social Security Administration participating in TEPCA. We have grown from at the end of 20 or before 2025, we had 10 million documents exchanged over the network. As of today, we have over 500 million documents that have been exchanged over the network. So the exponential growth really shows, as that trust, builds and as additional participants join, the value really increases. We're also working on what we call individual access services through TEPCA, which would allow any of us to use an app of our choice on our phones to be able to access our information across the country. So, for example, I've lived in Massachusetts and Wisconsin and now DC and Virginia. And so I've got data all over the place. And this is
Hmm.
an opportunity for me to be able to see that all in one place. And I'm sure, I'm just one small example of all of us probably have information that maybe we forgot we even had a provider in a certain place. And TEFCA is a way to be able to coordinate that care and make sure that patients have access to it when they need it.